all this going on, docs, and recognizing that there's not enough policy, there's not enough PPE, it just sounds like you're, trying to push a stone up a very steep hill. What is it that we, the public, and the patient population can do to help you guys?
Stay home.
Yeah.
Stay home and email your senator and congressperson.
Yep. Yeah. No, I agree. Like, the public health requirements, like, it helps protect you as the public, but it also helps protect your healthcare providers. Because if you start infecting your doctors and your therapists and your nurses and it goes around in a hospital, you can shut down a hospital pretty quickly. So I think that's the number one thing you can do. Advocacy. A lot of us are on the phone with our legislators. I've had at least 1 to 2 meetings with representatives in the state of Connecticut to really share with them the concerns about PPE and telehealth and the need to be able to get reimbursed, because currently Medicare does not reimburse physical therapists for providing telehealth to patients in most settings. And that's a real concern because it either increases risk to patients trying to get out, or more commonly, they forego really important care like fall prevention, like cardiac rehab. That's important. And people that lose function or decline in function after a hospitalization, they have a very high risk of hospital readmissions, which could occur at a time where there's already high surges and high use of the emergency room. And if they're still infectious, that presents a risk to everybody that they come in contact with during that hospital readmission, from a fall or a fracture. Doing a hip fracture repair surgery on somebody with COVID. Can you imagine drilling with bone and blood flying around it? It's an incredible risk to surgical staff. So stay home, adhere to requirements, but also don't be afraid to seek necessary care. Call. Let's be creative, and we can find ways to treat these patients, as effectively as we can with the lack of equipment.
Likewise, for those people who have issues but are not corona positive, they should seek PT first as part of they should really understand what that means, which brings me to my question. What does seek PT first mean?
Well, we should have had Sean explaining that. For people who are not positive, prior to the outbreak, we've had a lot of cancellation of care. Who we were seeing post total hip replacements, post knee replacements, were canceling care because the caregivers were worried that we would be bringing the virus into their home. So that's where telehealth became important, because we can follow up with them, make sure they do the exercises, the range of motion, and all this stuff, and making sure they were getting out, walking. Because even their follow-up visits with the surgeons were postponed because of COVID. So they're in a predicament as well. But they have a right to cancel care, or we can put the therapy on hold. For some people, their therapy has been on hold for like a month and a half, because the virus is still around. The ones who truly need it, but because they're scared, I've had patients ask me if I'm treating patients who have COVID, and I would tell them the truth and say yes. For the ALF sites I go to, I get scanned, my temperature gets scanned. I have to record my temperature every day and submit it. We do a pre-screening questionnaire asking if patients are having symptoms or if I'm having symptoms. And if I display any symptoms or my temperature is elevated, I have to stop seeing patients and go in quarantine. So, but people are still scared, even though we are taking necessary precautions not to pass the virus if we are exposed to it to them. And it's causing problems because people are just fearful. They're not seeking care that they would need.
Right. And so speaking of that, the other issue that I was aware of, I don't know if it's still the same, is not every insurance is equal in how it approaches physical therapy. So some people have insurance, but the insurance may not cover physical therapy. or it may inadequately cover it for what's needed for their care. So how do you guys assess and address that particular situation? And is COVID-19 making it easier or harder for those patients if they've been infected and now discharged home?
Visits, well, if you have private or HMO insurance, visits are usually managed. So they will give you probably 3 visits, 6 visits at a time. If the patient requires more, you have to seek an additional authorization for those visits. For Medicare patients, depending on the plan of care that you develop at the evaluation, you consult with the ordering physician to determine the frequency, but the therapist usually determines the frequency. So that's not usually limited per se.
Okay.
The HMO insurance, they have limited visits for patients.
What happens, I know none of you are in New York City, but what happens to the person who had COVID-19, admitted to the hospital, but was uninsured and is now discharged to home? Do you know what happens to that person?
It probably depends on the home facility.
Yeah,
Well,
I mean,
some hospitals do give 3 visits. Like, I know if you're uninsured and you went to the emergency room before, if you had a stroke or a heart attack, the hospital would request for you to get home help, because if you don't have insurance, you cannot go to a skilled nursing facility or subacute rehab. So they'll give you 3 visits to do at home. So in that 3 visits, you have to teach the patient and the caregiver
Wow.
what to do. And after those 3 visits are done, that's it.
Yeah, for Yale, they've done a couple of things. They have taken the entire student gym and turned it into a field hospital, where they're really using it as a step-down unit for patients who may not have any place to go while they're still infectious, to keep them in a place where they can still receive health care. So they may not receive specifically rehabilitation, but there's access to mobility and some exercise pieces. There's also a lot of hotels or other college dorms in the area that are actually being used to house specifically the homeless population or anybody that is COVID positive, to reduce community spread and make sure that those patients have appropriate health care and housing to promote recovery from the illness.
Wow. You guys are highlighting so many things that most of us are not thinking about, because we're seeing a lot of the front-facing stories, which is prevention, what happens when people don't practice social distancing, etc. But we're really not hearing about this back-end stuff, which is the truly chronic part of COVID-19 that's starting to manifest. That's amazingly scary. Amazingly scary.